Hey everyone, welcome back for another deep dive. Today we're going to be talking about something that I think a lot of people have probably experienced at some point in their lives.
Oh, yeah.
It's gastritis.
Gastritis.
Yeah, and people might think, oh, it's just a simple stomach ache.
Yeah.
But it's a little more complex than that. It's actually a condition where the lining of your stomach gets inflamed.
Right.
And so we've got a bunch of research and expert insights to kind of unpack what gastritis is all about.
Yeah. It's amazing how many people actually do experience gastritis at some point, but they might not even know that that's what it is.
Exactly. And so that's what we're hoping to do today is to really kind of break down what causes it, what are the symptoms, and even some ways to prevent it.
Yeah.
So consider this your cheat sheet to kind of becoming a gastritis expert.
Yeah, and we're going to try to break it down in as plain of English as possible. No medical jargon.
Perfect. Love that.
So the lining of your stomach is actually really important. It acts as a barrier against the strong acids that help digest your food.
Yeah, it's like a shield protecting your stomach from itself.
Exactly.
But when that lining gets irritated and inflamed,
Yeah.
that's when gastritis sets in.
Right. That's exactly it. That's exactly what gastritis is. And there are actually different types of gastritis.
Oh, really?
Yeah. So there's acute gastritis, which comes on suddenly.
Okay.
And then there's chronic gastritis, which develops more gradually over time.
So it's not just a one-size-fits-all kind of thing.
Not at all. Not at all. And the other interesting thing about gastritis is there's a whole bunch of different things that can cause it.
Okay, well, I'm all ears. Let's talk about these culprits.
Okay. So one of the most common causes, and especially globally, is a bacteria called Helicobacter pylori.
Okay.
So you might know it as H. pylori.
H. pylori. Yeah, I've heard of that. Sounds kind of like a villain from a sci-fi movie.
Kinda. So this bacteria actually can burrow right into the stomach lining, causing inflammation and setting the stage for gastritis. And the thing about H. pylori is that if it's not treated, it can increase your risk for ulcers and even stomach cancer down the line.
So this is definitely not something you want to ignore.
Exactly. Now, another surprising culprit is those everyday painkillers like ibuprofen or aspirin.
Wait a minute. So those over-the-counter drugs that everybody takes can contribute to gastritis. How does that even happen?
You see, while these medications are really great for pain relief,
Yeah.
they can actually wear down your stomach lining over time.
Oh, no.
And this makes your stomach much more vulnerable to those powerful acids.
Oh, so it's like they're slowly weakening your stomach's defenses.
That's a really great way to put it. And that's why it's really important to use these medications responsibly. And, if you're taking them regularly, talk to your doctor because there might be some gentler alternatives.
Yeah, that's really good to know because I think a lot of people just kind of pump those painkillers without realizing the potential impact they could be having on their stomachs.
It's much more common than you think. Now, we can't forget about alcohol. Excessive alcohol consumption is a well-known trigger for gastritis.
Yeah, I've definitely felt that burning sensation after a night out.
Yeah, it can really irritate and weaken the stomach lining, making it more susceptible to damage from those digestive acids.
Yeah,
So moderation is key, my friend.
moderation is key. Got it. What about stress? Can that play a role in gastritis too?
Absolutely. You know how they say stress can kind of eat you up inside?
Yeah.
It's kind of true, especially when it comes to physical stress from things like injuries or surgery or even severe infections.
So it's like your body's in overdrive and the stomach takes a hit.
Precisely.
Yeah.
So this is known as stress-induced gastritis, and it usually goes away as your body recovers.
Okay.
But it's a really good reminder that stress can have a real physical consequence.
Yeah, wow. I never really realized that stress could manifest in the stomach like that. So
Yeah.
we've got, bacteria, painkillers, alcohol, and stress. Those are some pretty common culprits.
Right. But there's one more cause that we need to talk about, and that is autoimmune gastritis.
Autoimmune, that sounds a little more complex.
It is. This type of gastritis happens when your body's immune system mistakenly attacks the cells in your stomach lining.
Wait, so your own body is basically waging war on your stomach?
That's a good way to think about it. It's a little bit of a mystery why this happens, but we do know that it's often associated with other autoimmune conditions like Hashimoto's thyroiditis or type 1 diabetes.
Oh, wow. So it's like your immune system kind of gets confused
Right.
and starts attacking the wrong target.
Exactly.
That.
And then there are a few other less common causes of gastritis as well. Things like bile reflux or severe trauma, or even certain medical treatments like chemotherapy can irritate the stomach lining and lead to inflammation.
Wow. It's amazing how many different factors can contribute to gastritis.
It really is. And I think that's why it's so important to understand the potential causes so that you can make informed decisions about your health.
Absolutely. Yeah, that's a great point. So we talked about what causes gastritis, but how would you know if you actually have it? What are some of the signs and symptoms to watch out for?
Well, that's a great question. And the thing about gastritis is that the symptoms can be really different from person to person.
Really?
Yeah, so some people have noticeable discomfort, while others might not have any symptoms at all.
So you can have gastritis and not even know it.
That's right, it's true. But for those who do experience symptoms, the most common one is abdominal pain.
Okay, so more than just your regular stomach ache.
Right, it's often described as this gnawing or burning sensation,
Mm.
usually in the upper abdomen, but it can also feel like a dull ache or even sharp pain. And the thing about the pain is that it can be sometimes worse after eating, but for some people, eating actually helps.
Oh, interesting. So there's no like one size fits all when it comes to symptoms.
Exactly. Everyone kind of experiences it a bit differently. Along with the abdominal pain, nausea and vomiting are also pretty common,
Oh, yuck.
especially with acute gastritis.
Okay. So are there any red flags, any symptoms that should send you straight to the doctor?
Absolutely. So if you see blood in your vomit, or if you have black tarry stools, that's a sign of bleeding in the stomach, and you need to seek medical attention immediately.
Got it. Blood in the vomit or black stools, those are serious. What about other less alarming symptoms?
So you might experience bloating,
Okay,
that feeling of fullness, even after you've only eaten a little bit,
right.
and that's more common with chronic gastritis.
So it's like you're constantly full,
That's right, that's right.
even if you haven't really eaten that much.
And then there's indigestion,
Okay.
also called dyspepsia, which can include burping, heartburn, and that general feeling of discomfort in your upper abdomen.
So a whole range of unpleasant sensations.
Exactly. And it's important to remember that these symptoms can kind of come and go, They might be mild one day and then more severe the next.
It sounds like gastritis is a bit of a chameleon. It can present in so many different ways.
Mm-hmm.
So let's say you are experiencing some of these symptoms. You go to the doctor. How do they actually diagnose gastritis?
Well, one of the most common and effective ways to diagnose gastritis is with an endoscopy.
Endoscopy. I've heard of that,
Yeah.
but I'll admit the name sounds a little intimidating.
I know it can sound a little scary, but it's really not that bad.
Okay.
Basically, they use a thin, flexible tube with a tiny camera on the end
Okay.
to look directly inside your stomach.
Oh, wow. So they can actually see the lining of the stomach and check for information.
Exactly. It gives them a real-time view of what's going on in there. They can look for any redness, swelling, ulcers, or other abnormalities.
That's pretty amazing technology.
It is. And sometimes they'll also take a small tissue sample during the endoscopy,
Okay.
called a biopsy, and this allows them to actually examine the cells under a microscope,
Wow.
which can help confirm the diagnosis and also figure out the severity of the gastritis.
So they're really getting a close-up look at the cells to see what's happening.
Precisely. And they can also use the biopsy to test for the presence of that H. pylori bacteria.
Right, because we talked about that's a major cause of gastritis.
Exactly. And there are other tests specifically for H. pylori as well, like breath tests and stool tests,
Okay.
which can also help guide treatment.
So they've got a whole arsenal of tools. What about those imaging tests like X-rays? Do they use those for gastritis?
They can, but X-rays and those upper GI series don't actually show the inflammation itself. They're more helpful in identifying things like ulcers or erosions that maybe weren't visible during the endoscopy.
Oh, so it's kind of like getting a broader picture
That's a good way to put it.
of the digestive system.
Yeah.
Okay, so once the doctor has all this information, they've got the visual from the endoscopy, the biopsy results, maybe some other tests, what happens next. What are the treatment options for gastritis?
Well, the good news is that most cases of gastritis are treatable.
Well, that's good to hear.
But as we've seen, gastritis isn't just one thing. The treatment really depends on what the underlying cause is.
So there's no magic bullet. It's about kind of finding the root of the problem.
Exactly. So, for example, if H. pylori is the culprit, the doctor will likely prescribe a combination of antibiotics
Okay, to get rid of the bacteria.
to get rid of that bacteria.
Makes sense. Kill the bacteria. Hopefully the gastritis clears up. But what about those pesky symptoms? What can you do to relieve that burning pain and nausea in the meantime?
Well, that's where medication can come in.
Okay.
There are a few different types of medication that can really help to manage those symptoms.
Okay.
So, for example, antacids
Okay.
can neutralize the acid that's already in your stomach.
Like Tums.
Like Tums, exactly. Those can provide quick relief from heartburn. And then there are proton pump inhibitors, or PPIs,
Okay.
which actually block the production of stomach acid.
So instead of just neutralizing the acid that's already there,
Sure.
they actually prevent more acid from being produced in the first place.
Exactly. And they're often more effective for long-term management of those gastritis symptoms.
And I think I've even seen commercials for those on TV, the PPIs. Are those safe to take long term?
That's a really good one for your doctor.
Right.
They can really help you weigh the benefits and the risks of any medication. And then there are also H2 blockers,
Okay.
which also reduce acid production.
Okay.
And they're often used for chronic gastritis
Okay.
to kind of keep those acid levels in check.
So medications can definitely play a role in managing the symptoms and addressing the underlying cause. But what about lifestyle changes? Can those help with gastritis?
Absolutely. Lifestyle changes are actually crucial,
Okay.
both for treating gastritis that you already have and also preventing it from coming back.
I'm going to guess that diet is a big one.
You guessed it. What you eat can really have a huge impact on your stomach health.
Okay, well, let's dive into that. What are some foods that people with gastritis should avoid?
Well, there are a few key culprits that are known to irritate the stomach lining. Spicy foods, for one.
Yeah,
Those can definitely aggravate gastritis.
makes sense. Spicy foods tend to bring the heat, and that's not what you want when your stomach's already inflamed.
Right. And then there are acidic foods and drinks like citrus fruits, tomatoes, coffee.
Okay.
Those can increase acid production and make your symptoms worse.
So those morning cups of coffee might have to go on hold.
Yeah, it might be best to kind of limit your intake, at least while you're experiencing those symptoms.
Okay.
And then there are greasy or fatty foods.
Oh, those are usually the most delicious ones.
I know, it's tough. But fatty foods can be harder to digest and can put more stress on your stomach, which is already struggling.
So it's like giving your stomach a break
Exactly.
from those harder to digest foods. What about alcohol? I'm guessing that's on the avoid list as well.
You got it. Alcohol is a major irritant to the stomach lining. So if you're trying to manage gastritis, it's best to cut back or even eliminate alcohol completely.
Okay, so lots of things to avoid. It sounds like a pretty bland diet. Are there any foods that are actually beneficial for gastritis?
Absolutely. The key is to focus on foods that are gentle on your stomach and easy to digest.
Okay, so bland doesn't have to be boring.
Exactly. So
Yeah.
think bananas, oatmeal, cooked vegetables, lean proteins, low-fat dairy.
Okay,
These are all foods that won't aggravate your stomach and will give it a chance to heal.
so it's all about soothing the stomach,
Exactly.
giving it a little TLC.
Exactly. What about water?
Oh, yeah. Is it important to stay hydrated when you have gastritis?
Water is essential. It really helps to dilute the stomach acid, helps to flush out toxins. It aids in digestion, keeps everything moving smoothly.
Okay, so lots of water, bland foods, easy to digest foods. What about probiotics? I've heard those are really good for gut health in general. Do they help with gastritis?
You know, there's actually some promising research that suggests that probiotics can be beneficial for gastritis. They can help to restore a healthy balance of bacteria in your gut, which can be thrown off by things like H. pylori infection.
So it's like giving your good gut bacteria a boost.
Exactly, to fight off the bad guy.
Where can you find probiotics?
Yogurt is a great source, as are other fermented foods like sauerkraut, kimchi, kefir.
Okay, so we've talked about diet. What about stress? And we mentioned earlier that stress can actually trigger gastritis. So I'm guessing that managing stress is a big part of the treatment and prevention as well.
Absolutely. Stress management is crucial for gastritis. Finding healthy ways to cope with stress can make a world of difference.
Again, I know this is probably a broken record, but any tips for managing stress?
Well, there's so many great stress-reducing techniques out there. You know, things like meditation, yoga, deep breathing exercises, spending time in nature, listening to music, reading a book, whatever helps you to kind of relax and unwind.
Yeah.
It's about finding what works for you
Right.
and making it a regular part of your routine.
So it's about finding your own personal stress-busting toolkit.
Yes, exactly.
And of course, if you smoke, quitting is one of the best things you could do for your overall health, including your stomach.
Couldn't agree more.
Okay, so we've covered a lot of ground here. We talked about medications, diet, stress management. What happens if you ignore gastritis and don't get it treated? What are the potential consequences of that?
That's where things can get a little more serious. Untreated gastritis can lead to some pretty significant complications.
Okay.
One of the biggest concerns is stomach ulcers.
Oh, ulcers. Those painful
Right.
sores in the stomach lining, right?
That's right. And they can actually bleed sometimes, which can lead to further problems.
Oh, that doesn't sound good at all. What causes ulcers to form?
Well, that pesky H. pylori bacteria is often the culprit.
Okay.
But ulcers can also develop from long-term use of those NSAID painkillers or excessive alcohol consumption or smoking.
So those same things that can cause gastritis can also lead to ulcers.
Exactly. And here's a really concerning fact. Long-term gastritis,
Yeah.
especially if it's caused by H. pylori, has actually been linked to a higher risk of stomach cancer.
Oh, wow.
Hmm.
Okay. That's definitely something you don't want to mess around with.
Oh.
So it's not just about discomfort. It can have some serious long-term consequences if it's left untreated.
Absolutely. It's definitely something you want to take seriously.
Yeah, so it's not just about soothing your stomach in the moment. It's about protecting your long-term health.
That's right.
Now, we also mentioned earlier that gastritis can lead to anemia. How does that happen?
Sometimes chronic gastritis can actually cause bleeding in the stomach,
Oh.
and this can lead to iron deficiency.
Okay.
And when your body doesn't have enough iron, it can't produce enough red blood cells, which leads to anemia.
It's amazing how everything in the body's connected. So we've got ulcers, cancer, anemia. Are there any other potential complications that we should be aware of?
There's also something called gastric outlet obstruction, which is a bit of a mouthful, but it's basically a blockage of the passageway between your stomach and your small intestines.
So food can't get through properly.
That's right. And it's often caused by scar tissue from ulcers, and it can lead to a whole host of digestive problems.
Okay, so the bottom line is don't mess around with gastritis.
Better safe than sorry.
It's definitely something you want to get treated. All right, before we wrap up, any final words of wisdom on how to prevent gastritis in the first place?
Well, prevention is always the best medicine.
Right.
And a lot of it comes down to those same healthy habits that we've been talking about.
Okay.
So things like making smart choices about alcohol consumption.
Right. Moderation is key.
Exactly. Enjoying a glass of wine with dinner is probably fine, but those heavy drinking sessions,
Yeah.
those are best avoided.
And being mindful of those over-the-counter painkillers.
Right. So if you do rely on NSAIDs for pain relief, talk to your doctor about finding alternative options that might be easier on your stomach.
And something as simple as washing your hands regularly can actually make a big difference.
It really can. It's all about reducing your exposure to that H. pylori bacteria.
Right. And let's not forget about stress management. That seems to be a common thread with so many health issues.
Stress can really wreak havoc on your body, including your stomach.
Yeah?
So find healthy ways to cope with stress, whether it's meditation or yoga or spending time outdoors or anything else that brings you peace.
I love that. Peace for your stomach, peace for your mind. Sounds like a recipe for good health.
I think you're onto something there.
So we've covered a lot of ground today exploring the causes of gastritis, the symptoms, how it's diagnosed and treated, and even how to prevent it.
It's all about understanding the condition so that you can make informed choices about your health.
I want to thank you again for sharing your expertise with us today. It's been incredibly informative.
It's been my pleasure.
And to all our listeners out there, thanks for joining us on this deep dive into gastritis. I hope you learned something new and helpful today.
Knowledge is power.
Exactly. Now that you know more about gastritis, you can take steps to protect your stomach and your overall health.
Gastritis is treatable. With the right approach, you can absolutely find relief. You can get back to enjoying your life without those uncomfortable symptoms.
Yeah, that's really reassuring to hear. To all our listeners out there, if you are dealing with gastritis, you're not alone. And there's definitely hope. Don't be afraid to seek help, make those lifestyle changes, and really just advocate for your own health.
Yeah, you've got this.
All right, well, that's a wrap on our deep dive into gastritis. Thank you again for joining us today. I hope this was informative and helpful.
My pleasure.
And to all our listeners out there, remember, stay curious, keep exploring, and take good care of yourselves. We'll catch you on the next deep dive.